Hello everyone, I am Dr. Jayashree Pathak. I am a consultant infertility and IVF specialist. Today I am here to talk about IUI. What is IUI, when it is done, what is the procedure, and what are the do's and don'ts and what are the success rates associated with IUI. So let's start with what is IUI. So as the name suggests, IUI is intrauterine insemination. So that means that what the procedure says that we prepare a semen, and after the semen preparation we inseminate with a very thin catheter inside the uterus. So that is called as intrauterine insemination. So when it is to be advised, there are certain major indications when IUI should be done, and there are certain major indications when it should not be done, because as I will tell you later what are the success rates. So patient selection is also very important for a good and successful IUI. So let's first, what are the common indications? Like most common is unexplained infertility. When we say that actually there is no cause, the sperm factors are okay, the tubal factor is not there, the tubes have to be patent for a good IUI, and the uterus is normal and patient is ovulatory, and at that time we see that actually there is no cause of infertility, but the couple is trying and they are not successful. So in that cases IUI sometimes is very beneficial, because what is the major procedure behind IUI is that we time the ovulation and inseminate the prepared semen very near to the ovaries, very near to the egg at the time of ovulation. So in unexplained infertility the success rate is actually good. Why? Because majorly there is no problem, and maybe the timing is something which is not correct. So when we do IUI the success rate is very good. The other cause could be moderately low semen factors, like the semen count is not optimal, say it is 20 million count, or as WHO says more than 15 million count is necessary for a normal semen count. So 20 to 30 million count is there. Motility is moderate, say not it is more than 40%, but it is say 30 to 40%, and these are the factors where you can go ahead with IUI. Third cause is when there is mild to moderate endometriosis, or there is a ovulatory cause. So in women, if there is a, sometimes we are doing ovulation inductions in PCO patients, and there is mild endometriosis, and there is some very small chocolate cysts, but otherwise the tubes are patent, and patient has been trying and they are not able to conceive. In those cases, when you do IUI with a very good semen factors, they are very successful in first or second attempt. The other cause could be a donor semen, where the male doesn't, the sperm count is very low or there is no sperm, and that time, but otherwise the woman factor is not there, and then donor semen can be done in a very under new guidelines under the ART laws, and donor semen IUI can be done. So these are the major indications for a successful IUI. Now what is the procedure as per? Now in IUI what we do is we prepare egg, and normally we all ovulate and the eggs are ready around day 14. But in IUI we can do 2 or 3 types of IUI cycles. Now one is natural cycle IUI. In natural cycle we follow the woman's natural egg which is forming, and then at the time of follicle monitoring we see that the egg is ready and we give trigger, and we do IUI say 36 to 40 to 42 hours post the trigger. Now that is one type of natural IUI. The other IUI is ovulation induction IUI. Now ovulation induction IUI we usually do with some tablets like clomiphene citrate or letrozole, and then also we do follicle monitoring. We follow the eggs, and when the egg is say around mature around 18 to 20 mm, then we give the trigger, and we do insemination around say 36 to 40 hours. Similarly, there is a higher grade when the success is not there, or there is a patient who has, as I told you, the major cause of infertility is ovulation. So in that cases we do controlled ovarian hyperstimulation. In that case, controlled ovarian stimulation. In that case, we do ovulation induction along with tablets. We give some amount of gonadotropin. So the eggs number also increase, and the quality of the eggs also increase. And in that also we follow the eggs, and when they are mature, say 18 to 20, we give the trigger and do the insemination around 36 to 40 hours. Now why we do every time trigger is because it is very difficult for us to time the ovulation, time the IUI if we have not timed the ovulation. So trigger actually ensures us the timing, and we are sure that by the time patient will come, ovulation will be somewhere near to it. So trigger is always given in IUI. It's never mostly not planned with a natural rupture, because then we actually don't know when the egg must have ruptured and when we are doing the IUI. So what all the procedures we do on the day of IUI? You come to our center, and then we give you a marked semen collection container, and we do the scan of the patient. We ensure that the follicle has ruptured, and then we give you the container with a proper name written of wife and husband, and with their age and with their UHID number. Then the husband gives the sample in the semen collection room. It is collected by a technician, and then it is prepared in the IUI lab by a proper senior andrologist. And semen preparation, once the semen or semen sample is collected, it is brought to the notice to the patient. Patient is taken up in the room, and with a very small thin catheter, the semen sample, after women's insurance that it is the same semen sample of the husband with the proper UHID, the woman is the sample is inseminated inside the woman. Now how long or what precautions are we supposed to take after IUI? Mostly we make the patient lie down for say 15 to 20 minutes, and the only reason for it is that the semen sample should not regurgitate back. Although that all is a myth, even if you immediately get it, if a proper IUI is done, actually there is no need, but we usually ensure that. Then post the procedure, we give you certain medicines which are supposed to take say for 18 to 20 days, and after the overdue, or once say if we are very sure you with the overdue, or say after 14 to 18 days when a urine pregnancy test or a blood beta HCG is positive, we ensure that yes, you have become pregnant. So this is how, and then you follow with us or a gynecologist for the further pregnancy workup. So this is how an IUI is done, and it is usually very satisfying for the couple, as there is very less stress to the couple. It's a simple procedure, no admissions and no OT, and with good success results. Now what are the success rates of IUI? Now that is very important. Why I would like to touch it upon here is that after any procedure, see, we all are human, and once we give any exam, you become stressed out, whether it's a 20-mark exam or it's a boards exam. So same it is, like a patient is doing IUI or patient is doing IVF. Ultimately the patient has some stress and the anxiety is there in their mind. So first of all, I basically tell the couples that what is the success rate and what they should expect from the this procedure. So IUI per se is only 15 to 20% success rate, and in a one cycle. And what book says, or we usually find in our practice, that if you do a cumulative IUI, say 1, 2 or 3 cycles, then the success rates are better. Now why, you will ask why? Now I think there are 2 or 3 reasons which I feel personally, maybe it's not academic. One thing is that in the first IUI we get to know that how is the patient cycle behaving, because IUI is not actually much in our hand. The eggs are very minimal, 1 or 2, and with basic medicines, with not a lot of control. So we are able to understand how the ovulation is and how is the endometrial lining going and what is the semen factor, because when the patient gives semen on that particular day, then embryologists give us a semen pre-wash and post-wash. So uh, if the patient is successful, then it's obviously congratulations and good news for both of us. But if it is not successful, then that IUI actually helps me or any gynecologist to think about the future. Now, if the IUI was really promising, when we see 2 or 3 very good follicles ovulating at a particular time and a very good semen, then we are very sure that you should go ahead with 1 or 2 IUIs more, because that gives us a very good motivation. And you should realize that IUI per se has a very low success rate, and if we are giving you a confidence that you should go ahead, then you should go ahead. And second, if the IUI on the day of IUI sample, the semen collection was not good, or the women's egg did not rupture at a proper time, or the lining was very thin, then also we get to know, okay, yes, there are certain factors with this IUI that even if we push in the next cycle, we might not be successful. This is from my take. So I think that yes, IUI should be done. At least give a good IUI should always be given 1 or 2 cycles, so that you interpret its success rate. So this is all about the IUI success rate. Now other is, what are do's and don'ts? Actually there are no do's and don'ts, because IUI is very much like a natural cycle. Just like natural cycle, there are no restrictions. In same way, in IUI there are no restrictions. IUI, you can just walk in, walk out. If your stays stays on first floor or second floor and you are habitual to the stairs, then you can keep on continue with your lifestyle. You don't need any bed rest. Just keep a low bland diet, in a sense that don't take spicy oily food, so that you don't have constipation. Don't eat outside food. Don't take papaya. Take healthy fresh food from your home, and take a lot of fiber, so that constipation, because of the progesterone, is not there. Post IUI, you can have relation for 1 or 2 days, but post that, once the ovulation has already been documented, you actually don't need to plan for pregnancy as such during this period, and you can continue your offices. And once the uterine pregnancy test is positive, please contact your nearby center or your doctor. So I hope I have given you all the answers. Now one more thing, like for donor IUI. Donor IUI, some people are very skeptical that it is allowed or not. Donor IUI, again, according to the government rules and guidelines, donor IUI can be done. It is not stopped by the government, but we all have to abide by the law, and there are certain guidelines set by the government, and we are also doing IUI according to those guidelines only. So thank you very much. Do join us, or do join me for the next workup, and if you have any queries, please put in the comment section, email to me, or you can just drop in a message. Thank you so much, and I'm really happy to give you this information, and would be very happy to share further experiences in future. Thank you so much.